Hi, my name's Angel McCormick, and I'm going to be talking about psychotherapy, specifically cognitive behavioral therapy in the substance use disorder population. This also ties in with mental illness as well. So, for my background and significance of what I'm going to be doing my project on is cognitive behavioral therapy's influence on substance use disorder recovery in psychiatric patients compared to standard treatment alone. Um, let's see, and then standard treatment is just going to be like 12-step motivational programs and stuff like that that patients would normally go through in recovery. Cognitive behavioral therapy is based on the observation that dysfunctional automatic thoughts that are exaggerated, distorted, mistaken, or unrealistic in other ways play a significant role in psychopathology, which we've seen in practice. The proposed intervention is going to be psychotherapy compared to standard treatment and its impact on rates of recovery within a 6 months period. My evidence is the level 1, level 2 in qualitative studies. For the meta analysis, the systematic review, which would have been my level 1 evidence, 7 out of the 10 studies, and this was all types of psychotherapy, including cognitive behavioral. 7 out of 10 showed improvement, with 2 showing medium but non-significant difference. However, there were no negative effects of the intervention. And then with the level 2, the quality of life improved with the therapy presented, and it was a pretty significant difference between the pre and the post. And then the follow up, which was, I believe, 3 months later, it had decreased a little bit, but it was still above the pre intervention quality of life. So, back to the theoretical framework is going to be cognitive theory by Aaron Beck, which is now cognitive behavioral theory. And it's basically the thinking influences our emotional and behavioral experiences, and working toward changing one's thoughts can be used as a means to alter feelings and behaviors. And this stuff is kind of briefly touched upon in standard treatment, but it's not in depth. I feel as though the patients could benefit a little bit from therapy more in depth than what they're getting in group settings. So, for the implementation plan, to kind of recruit patients, it's going to be either in the recovery setting at a facility or within practice. And I'll be using a comprehensive addiction and psychological evaluation. It's the CAAPE tool, and it's used to identify concurrent disorders and their relation to treatment for diagnostic and referral purposes. So within the office, and then in this case, the referral purpose would be with the therapist for the cognitive behavioral therapy, someone who specializes in that therapy in particular. Let's see, the two groups will be divided into cognitive behavioral therapy and standard treatment, but those in the cognitive behavioral therapy will go to that before their standard treatment. So they will be getting both, but standard treatment will just be getting that alone. And the therapy will not affect the standard treatment at all. So that'll be separate, but they'll get both of them. Let's see. So the behavioral therapy group will meet bi-weekly, so every other week, and they'll meet for 60 minutes, so 1 hour, with a psychologist for 6 months before their standard treatment sessions. And like I said, the standard treatment group will be separate from the therapy, and those will take place in the standard recovery facility. And then we're going to do a review of the patient progression via survey at 2 months, 4 months, and 6 months. So that'll be up to the 6 month time frame. And the treatment team, which will be the recovery support specialist, the psychologist, and the nurse practitioner who is running the the project. We'll meet monthly to discuss patient progress and anything that we need to alter, maybe for future reference. So the outcomes measured will be, I'll use the CAPE evaluation for participation for the participants, and then we'll measure the outcomes every month or every other month. And then the outcomes will be measured. So progress really for the participants, it'll be a 5-question survey, short, to the point, giving participants the chance to examine feelings towards therapy, any changes in thoughts and behaviors as they're progressing, and areas per improvement for the project as a whole, and then rating the therapy type 1 through 10. And it could be that cognitive behavioral therapy is not suited for everyone, that some people need trauma focused therapy and other forms of therapy. And we'll evaluate that as well, and see kind of what people think about their progress as we go. And we're looking for above 50% improvement with the behavioral therapy. You know, we want to see improvements on that scale compared to the standard treatment. And the outcomes will be evaluated by the nurse practitioner and formed into a flyer and PowerPoint presentation for dissemination of the evidence. And this will basically be the majority of my project. Thank you.